Hello, everyone. This is just a short introduction to a very interesting subject. One, it matters to of us as an oral maxillofacial surgeon, and one which has fascinated me from the very beginning of my career. If somebody asks me now, after 30 years of practicing and academics in oral max, which is the most important subject for you, I wouldn't hesitate to say facial aesthetics. Facial aesthetics is very tough. It's very important, but very tough because it has many different ways to approach this subject. And if we take the conceptual approach, and it's a relationship with beauty. Come on, what a subjective um, terrain to go deeper and lost ourselves and trying to understand beauty as the goal of treatment for us. Come on, it's hard. The psychiatric relationship of this when we say self-esteem, self-image, and what those things uh, can do to our behavior in the adolescence and the teenagers. This is a real problem. Our facial appearance is very important in those situations. And if we go to academics or the scientific standpoint, we have been trying forever to accommodate these things of facial aesthetics in numbers and Marquardt theories or golden proportions or explanation of what is what we have to do. The psycho-emotional aspect of this. Wow, what a deep goes when we relate our face to our biotype with our personality and the conceptual phase, the frustration, the fear, or the happiness that we show in our face. Somebody, and I like to say that our face is the mirror of our soul. Taken as an example, the aging phase. Aging phase, top subject. How we growing old and how our face is showing that, and what is psycho-emotionally the answer to that. Can we adapt? Well, actually, facial aesthetic has to be very strongly how we act in socially. So from the social standpoint, it is important because our face dictates some expectations in our work in the classroom when we're young. Since the kids are 7-year-old, at that time they correlate beauty with goodness and ugly with bad behavior, bad boy. So it is very important how facial aesthetic relate to the social aspect of our life. And of course, we cannot forget as a clinician, a practitioner that is supposed to provide facial aesthetic, we do need to address the clinical aspect of these terrible subject. Do we need standards? to know what to do? Do we have global standards? I can use any standards. Does the Nordic standards apply to me here in the south of the world? Should I use the Latin standards? Are there any Latin standards? Do the people in Mexico looks like here in Chile our patients? Oof, stuff. We have done some research and we have our own standards, but you know, I don't think at this point of my career, I don't think we need standards to analyze a face and decide what our patient need. This get more tough when we have to plan the surgery, the orthognathic surgery, they say, in our patients. So when we deal with comminuted facial fractures and we have to restore, which is different when the patient was born with a malformation, microsomia, facial microsomia, or golden heart syndrome, or Cruzon, or cleft lip. So we have to take very seriously facial aesthetics into consideration, and is a fantastic subject. We'll address this in a small capsule like this. This is just the introduction. And we'll do it in English and in Spanish so we can reach more people around the world. Thank you. We'll see you around.